Well, it's time now for Medical Moments with Covenant Healthcare. Today we're talking about atrial fibrillation. Now with me here today is Dr. Loai Maroof. Thank you so much for being here.
Thank you for having me.
First of all, can you explain, what is atrial fibrillation or AFib?
Okay, so atrial fibrillation is essentially a short circuit in the electrical wiring of the heart that causes the heart to beat out of sync. Usually when the heart beats, it beats in two parts. There's typically two top chambers of the heart and two bottom chambers of the heart. So normally the top part of the heart beats first and the bottom part of the heart beats second. That pushes all the blood out to the body in a consistent manner. So when people develop irregular heartbeat, AFib, then the top part of the heart isn't contracting in an organized fashion. It's actually quivering very quickly, and the bottom is racing to try to keep up. So that causes the heart to beat out of sync and less efficient than normal.
Okay. What are some common signs and symptoms people should watch out for?
Yeah, there's a lot of varieties of symptoms, and it's quite diverse. Probably the first thing that we ask most people is, do you actually feel your heart racing or skipping? So we ask for palpitations, but many people don't actually exhibit that symptom. Other people have other subtle signs, things like shortness of breath or being more tired or more fatigued, a lack of energy. Some people get dizzy or lightheaded. So those are other things to look out for.
Are there treatment options for AFib? What's out there for it?
So there are really two goals of treatment with atrial fibrillation. The number one goal is to try to get that person back into a normal heart rhythm, and we can do that typically with certain types of medications to help control the heart rate or to help to get them back into a normal rhythm. Some people need a little more help, so in that case we try to reset the electrical system of the heart using an electrical shock. And in some cases we actually need to go on to other procedures that are a little more invasive, particularly ablation, which basically maps the electrical system of the heart from the inside, and then we try to find the short circuit to see exactly where it is.
Why is it so important for people to get treated if they have AFib?
So there are two major consequences if the atrial fibrillation is not addressed. In itself, AFib won't necessarily kill someone, but it does put them at risk for two major problems. Number one, it can put them at risk for heart failure because if the heart is racing too fast, it essentially gets tired and the heart starts to weaken. Number two, it puts them at pretty high risk for stroke. And that's a really big issue that we try to prevent.
Absolutely. Now, if someone has signs and symptoms of AFib, like you said, the racing or any other symptoms, what should they do?
First thing is to talk to their doctor. If it's a consistent issue, many times they can actually go into the doctor's office and get a simple EKG, and that could diagnose it. However, some people have a tendency to go in and out of atrial fibrillation, and that's a little more difficult to catch. In that regards, the doctor may prescribe a heart monitor to wear to see if we can actually catch it.
Okay, wonderful. Why are you so passionate about the work you do at Covenant?
I think we're passionate because we can actually make a difference. We live in a time in modern medicine where we have so many technological advances, and we can use that to better the quality of lives of our patients.
Right. Wonderful. Thank you so much, Doctor, for being here with us today. And if you'd like any additional information on today's topic, you can head over to the hot link section of WNEM.com.